Yeah, I'll briefly talk about the liver model. It's one of the models we have set up here, so we are running in-house, and it's what you kind of can see here in this closure graph, a system setup of a two-chamber system, so with vasculature up top, and then the hepatic compartment on the other side. We put endothelial cells in the top channel and perfuse it then with medium for the vasculature, and then we below have a non-perfused channel where the hepatocytes are sitting. We can make this more or less primary, depending on what your setup is required of. We can have, usually we would use endothelial cells from the liver, so liver sinusoidal endothelial cells, and then underneath we can have either primary hepatocytes, but usually we use a cell line, which still has a huge potential of doing all the metabolic activity that a liver should be doing. You see here kind of then the idea of immunofluorescence in the end of the vasculature. We have a monocyte sitting in there, so some of the monocytes are also then can be found then sitting or integrating into the vasculature, and then we have the hepatic compartment on the other side, which is expressing a lot of the standard hepatocyte markers. So they are making albumin, they are making urea. We have a much higher expression of the transporter proteins and metabolic enzymes that are found in the liver. So MRP2 or the various SIPs we are looking at are much higher expressed in this then 3D structure, where especially the interaction with the endothelium on the other side gives a huge boost to expression of the hepatic enzymes and the hepatic transporters compared to a 2D culture. Also, when we look at this microscopically or in the electron microscopy, they look much nicer once they're having the perfusion on the other side and are having the interaction with the endothelium, and also to some extent with the monocytes, which make it even nicer as they're kind of for tissue integrity. As immunologists, we're always very happy to see how the immune cells are actually also not just providing immunity to infection, but also helping for tissue integrity, which we can also see in these models if they are interacting with the tissues. We do see then also when we can do studies with this, something that I just picked out now of some of the presentation slides we're having, and if you have specific more interests, we can also certainly ask more specific questions. But for example, we can treat them with LPS as kind of then one of the inflammatory models we can do, and we see that monocytes, which are here now stained in green, are interacting more with the endothelium as they're getting stimulated with LPS, and we also see them moving into the hepatic compartment in a more active state. And then there we can also see the inflammation coming up. So if we then model cytokine secretion on the hepatic side, where we can sample during the experiment, we can sample the supernatant in the lower channel of the hepatocytes, and then we are seeing the interleukin and TNF secretion here. This should actually be videos, I'm told, but I think I can't start the video. So it's very pretty, actually. If you see this, you can do live microscopy, and you can actually see the monocytes moving. But this is kind of here with the webinar presentation mode. For some reason, I can't interact with this, but maybe also a teaser to one other question we see there. Of course, you can do live microscopy, so you can see immune cells moving. If you stain them beforehand, you can see them integrating into tissue. It's very pretty to look at, and a wonderful technique where you kind of, without having a tremendous kind of in vivo imaging or mice or so, where you can actually see immune cells interacting with the tissue. So with this is kind of the idea of what we can do with the liver. We can do infection studies, we can do inflammation studies, and then certainly the tox screening. Usually then we would look for stress markers on the side of the hepatocytes as they're reacting to toxins or so.